Long before the Greeks were debating the humors and 2 millennia before Europe figured out how to wash its hands, a man named Sushruta was performing complex operations on the banks of the Ganges. His textbook, the Susruta Samhita, describes over 1,100 illnesses and, more importantly, 300 surgical procedures. He didn't just try surgery, he codified it into a science, proving that the human body could be dismantled and repaired. Why was surgery so advanced in ancient India? Ironically, it was partly due to brutal criminal justice. Cutting off a person's nose was a common punishment for various crimes. This created a massive market for reconstructive surgery. Sushruta developed a technique that is still the foundation of modern plastic surgery, the pedicle flap. He would cut a flap of skin from the patient's forehead, keeping it attached to maintain blood flow, twist it down, and graft it over the nose area. Sushruta wasn't just a surgeon, he was a tool designer. He described over 120 surgical instruments, many of which were inspired by the natural world. He had forceps shaped like the beaks of eagles, crows, and lions. He categorized them into blunt, yantras, and sharp, shastras, and he insisted they be made of high-quality tempered steel. His attention to detail was so extreme that he taught his students to practice their cuts on gourds, cucumbers, and dead skins before ever touching a human patient. Perhaps his most miraculous feat was the couching of cataracts. Using a specialized curved needle, Sushruta would push the opaque lens of a blinded eye out of the way, instantly restoring a level of vision to the patient. It was a high-risk procedure that required nerves of steel, but it proved that even the most delicate parts of the human anatomy were within the reach of a skilled hand. How did surgery impact the human lifespan in 600 BCE? The critical factor: infection. While Sushruta's techniques were brilliant, he lived in a world without antibiotics. However, he was a pioneer in surgical hygiene. He advocated for the use of fire to sterilize tools and the use of wine as a mild anesthetic and antiseptic. By fixing physical trauma, setting bones correctly and repairing wounds, he prevented the secondary causes of death that claimed so many lives. For a person in the ancient world, a successful surgery wasn't just about fixing a nose, it was about avoiding the slow, painful decline of a body that had stopped working. Sushruta taught the world that the body is not a sacred mystery beyond our touch, but a structure that can be understood and healed. He transformed the physician from a passive observer into an active mechanic of the human frame.